Here with us now is Dr. Christopher Doering from Franciscan Health. Always great to see you. Thanks for joining us.
Absolutely. Good to be with you again.
So let's just get right into it. So a new study came out reporting that 46% of Americans are, only 46% of Americans are willing to get a COVID-19 vaccine when it comes out. Those aren't really the numbers that we're looking for. And I'm thinking that part of the reason is because of just in speaking with some people is that they think that the vaccine contains the actual coronavirus. So is there truth to that? Or if not, what makes up a vaccine?
Yeah, that's a really good question, and certainly something that needs to be clarified. So there are some vaccines that are made with killed viruses or sort of viruses that have been disabled. That's not the case with the COVID vaccines. Small fragments of the RNA from the virus have been included in these vaccines, which makes them both incredibly safe and very, very effective, much more effective than what we were hoping for and expecting. So absolutely no concern that someone could, quote, get COVID from the vaccine.
And anything else that you want to add to sort of the safety and effectiveness that we've seen so far in these clinical trials? And will the FDA is slated to meet on December 10th and convene and make their decision?
Yeah, so the 46% number you cite isn't overly surprising for a brand new vaccine, and with all of the swirling information about COVID that's been out since before day one. But what I'm hopeful is that as more and more healthcare workers get vaccinated, as our most vulnerable populations get vaccinated, people will continue to warm to the idea that, hey, this vaccine is safe, people are getting it, it's effective, it's really helping us win this battle. And I think there's no doubt that once we get that critical mass of people who've been vaccinated and or had COVID, that we'll achieve that herd immunity and turn the tide on the spread of the vaccine. So, I think we're entering into one of the more optimistic phases, even though we're currently all a little bit overwhelmed by the numbers we're experiencing today.
Mm-hmm. So people should not be concerned that they're going to be infected with the coronavirus as part of being vaccinated.
Not at all. Not unlike the flu vaccine, though, people may get mild symptoms for a few days after getting the shot, but no risk whatsoever to getting COVID from the vaccine.
And just quickly, while I have you with us, so if someone has already been infected with coronavirus, there's some sort of sense that they don't need a vaccine. What are your thoughts on that? What would you tell someone who feels that way?
No, that's a great question as well. And in fact, we will be actually asking people who have had documented COVID within the prior 3 months to sort of step back to the back of the line. But it's perfectly safe to take it if you've had COVID, and it will help continue to boost your immunity against the virus. So certainly safe to get it, but wouldn't be the highest priority people to get the vaccine if they've recently had the illness itself.
Mm-hmm. And I'm also hearing them say that they are under this impression that because they've already been infected, they have the antibodies, having this sort of sense that they have these antibodies and that they, because have been infected, will now have them from now on. But that's not true, is it?
Well, it's a little early for us to tell how long the antibodies will last and the immunity will last. There's some indication that in some patients, it actually wanes after about 3 months. But there are other types of cells in the immune system, other components of the immune system that we believe may persist for many months, if not years. And so until it's been around for that long, we won't know exactly how all that works. And we certainly don't know at this point whether the vaccine will become an annual vaccine or if it'll last longer than one full season. So.
Mm-hmm. So just because someone has had the coronavirus doesn't mean that they're in the clear. It hasn't been long enough. We don't know exactly how long those antibodies last, and they might not be first in line to get the vaccine, but it is recommended that they should. Is that what I'm hearing?
Absolutely. And the only reason I say to step back to the back of the line is because the supply will be somewhat restricted very early on, but the production is incredibly robust. And so we do expect to have plenty of vaccine to vaccinate anybody who wants one by the middle of next year. regardless of whether they've had COVID already or not.
Okay, great. Dr. Dering, always great to see you. Thank you.